Concern continues tonight as people in Eugene digest the news that PeaceHealth Sacred Heart University District Hospital closing its doors beginning this November. Thanks for joining us. I'm Brandon Kamerman. Kendall Bartley is on assignment. Now, the closure is having a ripple effect. One of the biggest concerns is what it means for patients of the behavioral health unit. PeaceHealth plans to continue providing behavioral health services at University District until there is, quote, a sustainable alternative in the community. But that alternative is unclear right now. However, what is clear is that the Lane County Stabilization Center, which is referenced in the PeaceHealth press release, is not an alternative to the University District's behavioral health unit.
The stabilization center has been in the works long before this news ever dropped. It will continue to be in the works, and that will go forward. But in terms of replacing the behavioral health unit, that's something that's going to have to be addressed later on.
There is a complex system to serve people with behavioral health challenges, and there are many missing pieces to that system. The behavioral health unit is one of those pieces that is not missing. It's in place. The stabilization center is missing. When and if we can figure out how to get that initiative off the ground, it will not be a replacement. We need both those pieces.
So what is the Lane County Stabilization Center? Well, it's set to open in 2025 as a site where people in mental health crises will be able to go for immediate care.
What would be considered a behavioral health or mental health emergency room, crisis place. So for anybody in Lane County who is having a mental health or behavioral health crisis, they can walk through those doors and receive interaction with a human being and some stabilization right away.
Now, PeaceHealth clarified in an email that it did not intend to portray the stabilization center as an alternative. A spokesperson for the hospital went on to say, quote, our behavioral health unit in its current form is not sustainable, but we intend to continue providing behavioral health services at the University District location while working with state, county, and community partners on alternative care models. Those models would be beyond the scope of the services at the stabilization center. As the fallout from PeaceHealth's announcement continues, KVAL asked the question, what happens to patients who will soon need to be transported further for care? First off, according to PeaceHealth CEO James McGovern, many of the area's critical patients were already being taken to Riverbend since it opened in 2008. McGovern said the facilities there are better suited to care for patients in need of life-saving interventions. However, talking with a nurse from the emergency department at University District, those extra minutes a patient spends receiving treatment in transit rather than in a hospital can be the difference between life and death.
And there's a certain amount of care that the paramedics can give in the ambulance on the way there. But they can't do everything, and they can't give all of the care that a person needs to survive a heart attack.
KVAL reached out to Eugene Springfield Fire to see how they will be impacted by this decision. They tell us they're working to understand how this change will impact ambulance service and availability. We'll be sitting down with EMS workers next week to seek further understanding of the true impact of this change. Student leadership at the University of Oregon is also concerned. The Associated Students of U of O say students rely on having an emergency room close by.
That change from immediate walkable access to a 24-hour medical emergency department to a 15-minute drive is going to have such a negative impact.
She adds that the student organization is working with the university to ensure students do have access to emergency services. The university does offer a 24-hour nurse line designed to direct students to resources, but Webster says it will not adequately serve the community's needs. The university sent us a statement in response to the hospital's closure, which reads, in part, we offer a wide range of services to meet the health and mental health needs of our students, faculty, and staff members. This care includes after-hours support. The nurse advice line is available for students when University Health Services offices are closed on evenings and weekends. There's also a mental health support and crisis line. You can find the entire university statement on our website. And we shared a poll on our Facebook page asking viewers if they think Eugene needs a hospital. The results show the majority of voters say, yes, Eugene does need a hospital. Out of the 120 people who responded, 85% voted yes, and 15% voted no.